Joining us this morning for an update on conditions at San Juan Regional Medical Center, Jeff Bourgeois is here, the president and CEO of the hospital. Jeff Bourgeois, good morning. Thank you for joining us this morning.
Good morning, Scott and Megan. How are you all?
Doing well, thank you. And I guess the other question is, how are you all doing at the hospital? What are conditions like this week?
Well, Scott, as you know, I'm speaking to you on Wednesday morning, January 20th, and our overall inpatient census at the hospital has softened a little bit over the last 24 hours, which is great news for us. We were really exceptionally full for the better part of the last 2 weeks and going into the early part of this week. However, as of this morning, we are down to an inpatient census at the main hospital of 150. We do still have 63 positive COVID patients and another 20 patients under investigation. So it's a total of 83 COVID-19 and DUI patients in-house. So still a very busy respiratory and COVID-related census at the hospital. Our non-COVID, non-respiratory census is what has softened over the past 24 hours. And that's good news for us, and I believe good news for our community. Additionally, as mentioned before, we look at our 7 and 14-day rolling test positivity averages. And as of yesterday, both were, for the first time in many days, actually really going back to mid-November, below 20%. The 7-day average is now reduced to approximately 15%, and the 14-day rolling average just moved under 20% yesterday. So really good news. We hope that trend continues downward. As you know, our state has set a target as part of the red, yellow, green criteria of 5% being the positive rate that would allow a county to move that specific criteria into the green category. So we're encouraged by that. We've also fully vaccinated approximately 1,200 individuals. Most of those are our employees, but we've also done a number of other Tier 1A individuals in our community, other healthcare providers, physicians and physician office employees, and first responders such as fire department and police department personnel. We are also working closely with the county and Department of Health with respect to Tier 1B and subsequent vaccinations. That the county and the Department of Health will lead those efforts in our community, and we will collaborate in however we are asked to do so.
Great. Yeah, so that's like a trepidatious sigh of relief, if you will. So what about the ICU census, Jeff?
Okay, let me, it's still very heavy. As of this morning, we had 12 of 14 beds in our respiratory ICU occupied, and 7 out of 9 beds in the non-COVID ICU occupied. So very busy, obviously, and we were able to coordinate yesterday on Tuesday, even given the snowstorm we had, to help transfer some patients to Albuquerque to offload a little bit of our really high census that we were experiencing on Tuesday, the 19th.
And that's good news. And I guess that would tell us, too, that maybe the other hospitals in our state are also softening a little bit, to use your terms, Jeff Bourgeois, that they're able to accept some of these transfer patients from San Juan Regional Medical Center?
Yes, that's accurate, Scott. And the lessening of their census began several days before ours. So that's exactly spot on. Their bed availability helped us move some patients.
And are you hearing any reasoning why this is happening? Was the increase in cases maybe from the holiday season? Is that kind of tapering off a little bit, or is anyone been able to put their finger on why this is happening? Does the vaccine seem to be helping a little bit?
Well, it's actually, our COVID census really hasn't dropped off that significantly. As I mentioned earlier, it's the non-COVID, non-respiratory census that's dropping back off. The most recent modeling, that I believe we've had a chance to review is now well over a week old from Los Alamos National Labs. But it shows that we should, here in the Northwest region, continue to expect a pretty heavy COVID-related inpatient census for the next 4 weeks or so. So it is still, we believe, part of a post-holiday spike, if you will. You know, if you look at our test positivity rate that really peaked in the first week or so. I'm gonna go back to that report. Excuse me.
Sure.
We really peaked on that test positivity rate in the couple of weeks after Christmas, and you know, that's what really bumped our census up, I believe, particularly last week. And so hopefully that is now going to correlate into lesser COVID census for us going forward.
Right. Well, and we can remember seeing some of those positivity rates of 20%, 19%, and you're telling us that it's down maybe by 4 or 5 points. So that's good news.
You bet.
Very good. Well, Jeff Bourgeois, we always appreciate your time, and to extend our thanks to all of the folks who are working with you at the hospital on the front lines. And one of those people is actually on the line as well, and we want to talk to her this morning. Dr. Erin Philpott is back with us to give us a little bit of an update and answer some of our questions. Dr. Philpott, good morning to you. It's great to have you back on the program this morning.
Good morning. Thanks so much for having me.
You bet. It's great to have you. I know Megan has a couple of questions, as do I. So we'll start.
Yeah, we're ready to nerd out. It's been a while.
There you go.
So I've been reading stuff on the COVID brain, as they're calling it. We've known about brain fog, issues with memory, some issues with mood. So I was wondering if there's any current updates on the COVID brain and whether or not we know how lasting these damages are.
Yeah, that's a great question, Megan. You know, just to start, I'm a hospitalist, so I'm seeing really the acute COVID situations here, and we are most certainly, as Jeff pointed out, been not without many cases of acute COVID. So I haven't seen too terribly many patients in follow-up, though I'm in close contact with the COVID to Home group as we meet every week and kind of discuss cases to ensure we have some continuity from our inpatient environment to our outpatient. So definitely I've heard different stories from their group, and of course been doing some reading myself. And just to start, I think we're getting a little bit clearer of a timeline on the continuum of COVID. It's being sort of broken down into 3 parts now. The acute COVID, which can last up to 4 weeks. We have people bumping in and out of the hospital that seem to improve and then have another acute worsening of their status, whether it be respiratory or other issues, prompting return. And then the second is just ongoing symptomatic. Some people, for whatever reason, are getting these really sort of protracted continuation of their initial illness, which goes from 4 to 12 weeks. And then the post-COVID is the third category on the continuum, if you will, that has received a lot of different names and kind of varying by country and what exactly is going on, but that's considered greater than or equal to about 12 weeks of ongoing symptoms and issues, and has been called the long haul. I think that's the most common name in the U.S. Long COVID, long-term COVID, post-COVID syndrome, to sort of describe this phenomenon that we're seeing, and now millions of people. The super interesting thing about this is this gathering body of evidence is sort of started mounting on social media. I think it's, you know, we are so consumed by dealing with the acute COVID situation that people are, you know, desperately looking for help and support that are experiencing these long-term symptoms. So it's just a little bit, it's a very interesting sort of unfolding of literature information, I guess would be a better way to explain it, of people reporting exactly how they're feeling. And there's all these different websites and databases collecting information on this now, and some observational studies. So to specifically focus on the psychological or the cognitive effects of COVID, I did look at one study. It was about 100 patients these are specifically hospitalized patients, but I will say this long COVID or long haul COVID can occur even in people with more mild illness, is what we're finding. So people who never make it to the hospital. And I know we've talked about that before. But this specific study looked at 100 patients discharged from the hospital. 24% of them reported PTSD, and I find that an alarming number as a hospitalist. I think this is an extremely scary time for people, you know, as we've been so consumed by the news and the pandemic, and have, you know, in our region, so many people have had loved ones die. They're here, you know, unfortunately, just due to visitor policy restrictions, which have been implemented across the country, often alone. And I think we've been really trying to work hard on focusing on meeting people's needs and doing mental health check-ins to make it as smooth and, you know, minimize sort of the fear and how people are feeling here in the hospital. But anyway, 25% with PTSD, 18% with new or worsening memory problems, and then 6% with concentration issues. And then I think another study found that over half of COVID survivors reported worsening quality of life. And then there was some other mention of a higher rate of new onset psychiatric issues. And there's a lot on sort of these support groups about sort of post-COVID being associated with this thing called ME, or chronic fatigue syndrome. And some very similar parallels to what those patients experience. So just in sum, I would say we see you out there for those who are suffering from post-COVID, and we are working to study and find out the best treatments. And it's going to take time, but I think you're not alone, and people are not alone in this. And I think we're going to have some more answers with time.
Thank you, Dr. Philpott. And it's something that we've been talking about, I think, since the very beginning of all this, about the ever-evolving understanding of COVID and what it does and how it impacts the body and all the things that you just mentioned. I wanted to ask you, too, about, in addition to the brain and cognitive impacts, we also hear about impacts to the lungs and maybe heart damage or things like that. Is that also something that you're learning more about?
Yes, definitely, Scott. There's a lot of studies on that as well, and those are more the sort of what we classify as the physical effects of COVID. You know, observationally, we've seen here in the hospital patients returning weeks later with new onset arrhythmias like atrial fibrillation, which is an irregular heartbeat, and then new onset heart failure. There's been a number of studies that have shown that there's some myocarditis or inflammation in the heart muscle after COVID on cardiac MRIs. A lot of people are, you know, the fatigue kind of tying in with the psychological impacts. It may be actually, you know, related to sort of these different physical effects on the heart and the lungs. A good number of patients who, especially those hospitalized, but even some who are not, do have at least, you know, in the short term lung damage. So we found decreased pulmonary function on objective testing after COVID. So definitely the virus or the inflammation from the virus is having a physical impact, and at least, you know, hopefully kind of more in the temporary realm. Hopefully we'll see that these people recover with some rehab and support and regain their pre-COVID exercise tolerance and ability to just high quality of life. There's a lot of chronic coughs that are going on for quite some time. So the most common physical things are fatigue, dyspnea, chest pain, and cough related to the number of different COVID manifestations. And then some of the less common but still seen things are ongoing loss of sense of taste or smell, joint pain. We see a lot of headache, dizziness, and sleep difficulty. That's been a common one both in the acute period and in the post-COVID period.
Wow, gosh, it's like every day.
It's a whole laundry list.
It's a whole hundred.
Right?
I know, it's such a nasty. Yeah. But so we've heard about mutated strains. Of course, viruses are always mutating, as we've been told. But what is the update there on those strains? And we've talked before about these other coronaviruses, the MERS virus. And have we studied those enough to give us information on how to deal with these? And are these mutated strains more dangerous? Are they less? What's going on there?
Sure. Yeah. Great question and super interesting stuff. So the good news is, we'll start with that, is there's no evidence so far suggesting that these new variants cause more severe disease. So the viruses, I actually don't know too much if we study this specifically, the mutagenesis among the MERS and the SARS-CoV-1, but I will say we do know that flu, every year we have to get a new flu vaccine because of the antigenic drift. So it changes slightly to sort of evade our immune system or our antibodies that we have generated the year prior. We are not seeing that SARS-CoV-2 or COVID-19 is mutating at such a rate that flu does. In fact, it's been pretty stable. These mutations are obviously important for a number of reasons because, number one, it can affect the ability of the virus to spread. So that's like a gain of function. It's more effective in spreading between people, and that's, biologically good for it, survival of the fittest. It can also affect our vaccine efficacy. And so far, the two main mutants we haven't found, the preliminary data at least says that it is unlikely to, be different enough that the vaccine wouldn't work for it. And then also the monoclonal antibodies are targeting, which I would like to mention in a minute, are targeting a certain area on the virus and how it binds. So if it changes enough, it could evade that. And then I think those are the main things that it could change to evade or affect. The three main variants we're seeing are the number one, the UK variant, which probably everyone's heard of. It's the B117, and it has an unusually large number of mutations in it, and it's looking like it's spreading more easily. I think I read somewhere it's accounting for about 2/3 of cases in the UK now. So you can imagine it's the more effective at spreading, it will rise to the top sooner, this variant. So not causing more severe disease so far as we know. So that's good news. And the vaccine is still thought to be effective against it based on where the mutation is. The second variant is the South African variant. And that came in October. The UK one was in September, and that's 1.351, I think it was. And it emerged separate from the UK variant. There's some overlap, but also in the spike protein, not thought to be different enough, again, that the vaccine wouldn't cover it. And then the third newer variant, which sounds a little bit scarier to me, is the Brazil P1. And they found that in 4 travelers coming from Brazil to Tokyo. And it is a little bit more concerning. There is some evidence to suggest that previous infection won't neutralize it and possibly the vaccine won't cover it. But we don't have enough information on that yet, and it's been found in a very small number of people. Our country, the CDC, does have a system in place to look at these different variants across the United States because, as we've just talked about, it's very pertinent if we identify a variant and that has a significant different impact.
Very true, Dr. Philpott. And to be clear, right, we have identified at least one of those variants already in the state of New Mexico, if I'm remembering correctly.
You are correct. The UK variant has been found in the United States. We don't know exactly what's going to happen. I did read one article that just with this gain of function and its ability to spread, that it could cause a later surge, like a spring surge. But we don't know that with certainty yet, but just kind of modeling after what it did in the UK, I think that's possible.
Right. And you mentioned the vaccines too, Dr. Philpott, and I had a question for you about that. We are hearing that for folks who've been vaccinated against COVID-19, they may not get sick, of course, but it's possible that they could still spread the virus to others. Is that correct? And I guess, how does that work? It's able to suppress it a little bit in that person, but not the infectiousness of it?
Yeah, this is a very confusing point and a great question. I think, we don't know is the bottom line. We don't know yet, I will say, because I think we will know soon. The Moderna vaccine trial did look at rates of infection in the vaccine and the placebo group, and it does appear that there was some evidence that the vaccine does prevent transmission. We know that a number of other vaccines in our that we've used in the past do prevent transmission. So it's not a slam dunk. It's definitely going to prevent asymptomatic transmission. And I think that's been the real challenging thing about COVID is we have all these asymptomatic or pre-symptomatic people transmitting the virus still. So you're out and feeling well, going to work, attending school, and carrying on with your daily life and shedding COVID and affecting people around you. So we don't know if that could possibly occur with the vaccine. We're hopeful it will not based on previous data. But that being said, we should not change how we are interfacing with society, our friends, our family, or what we're doing at the hospital, because there just isn't enough data yet to say we're good to go on this front. So, and I think especially thinking about the transmissibility of the UK strain and some of these different aspects that will be, essential, I believe very strongly the vaccine is going to be fundamental in ending this. We still need to wear our masks, wash our hands, maintain our social distancing, and continue to be very vigilant in all those public health measures.
Very good advice, Dr. Philpott. It's just a nasty little virus, isn't it?
As an understatement.
As an understatement.
Yeah.
Exactly. But it's not going away anytime soon, unfortunately, is what we're learning. So, Dr. Philpott, we can't thank you enough for your time this morning. And Jeff Bourgeois, again, to you, thank you for joining us, as you always do with an update. But both of you, we really appreciate the work that you are doing at San